Hi, my name is Cece Pezdek, and I have been in GI nursing for almost 27 years. And I was fortunate enough to be selected as one of the fellows in the inaugural 2012 program. I found this opportunity to be a professional milestone for me. And in addition to meeting a great group of passionate GI nurses and developing a network of GI specialists that I can tap onto, I think it really sparked an interest, almost an obligation, to give back to a profession that I have received so much from. And I've always been kind of intrigued with the concept of evidence-based practice. Now more than ever, evidence-based practice is more than just a buzzword. Whether you work in a magnet hospital, an academic community setting, freestanding center, or a physician's office, evidence-based practice needs to be implemented. As novice nurses, I think we all learned a wealth of information and many task-oriented procedures. But the time has really come to ask why we're doing things a certain way, not just that's the way we've always done it. The fellowship program provided the framework for this. Keeping in mind that evidence-based practice means decisions meet three main criteria, so we want decisions to be based on the best evidence available. Secondly, benefits and alternatives are considered when making decisions. And lastly, the decision is consistent with the values and preferences of the individual. So does that all make sense? Why is this so difficult? My initial project was to identify the barriers to implementing evidence-based practice. And one of the challenges, and also, it's a good thing that we live in an information-rich environment, but I think we're in information overload. And why does it take an average of 17 years to put research into practice? Important is timing. You need the right information at the right time and having access to that information. Now, the average age of the nurse is somewhere around 46 or 47, depending on what literature you read. And that tells us that many of the nurses working today, and I know this is true of where I work, it's a community hospital, and most of the nurses working in our endoscopy unit were in school over 20 years ago. So do most nurses have the skills? And that's something I did find out in my project in identifying obstacles to implementing evidence-based practice. And then last but not least, change is hard. We get comfortable in what we do, and changing it is not easy. The survey identified time as the biggest challenge to evidence-based practice implementation. In days when our economy is so strapped and our healthcare dollars are being scrutinized, we really have to pay attention to time, productivity, and all of those measures. I know we are at my institution. So that is a big piece. But in addition, as my survey showed, skills to critique the literature and lack of knowledge of both the research process and also the process for evidence-based practice are not easily identified. So how can we be better practitioners? And I don't want to oversimplify it, but we really need to learn to ask the question why. And one article that I shared with my staff, it was in a critical care nurse journal in 2011, and it discussed putting sacred cows out to pasture. I thought that really captured the whole idea. And one example, again, that really resonated with my staff was the practice of Trendelenburg positioning for hypotension. Why do we do that? Well, I know the idea of shifting volume from lower extremities to increase flow to vital organs, improve perfusion, and ultimately increase blood pressure all made sense, right? Did you know that research shows there is no change in cardiac index, tissue perfusion, or blood pressure when in the Trendelenburg position. In fact, we are creating more challenges when we do this. Trendelenburg positioning will increase lung resistance. Vital capacity is decreased, and then you have an increase in your hypoxemia. Not what you want to do. We are increasing abdominal pressure and also impairing the diaphragm as far as movement. So now we've decreased, as I said, the vital capacities, so respirations are more of an effort. In addition, depending on the body weight of the patient, as the body weight increases, so does the respiratory issues. Also, the risk of aspiration increases, central venous pressure increases, there's an increased risk of retinal detachment, and after all is said and done, there is no impact on blood pressure. So what's a nurse to do? Well, in this particular instance, keep the bed horizontal. Consider raising the legs. This actually correlates with the need for fluid replacement. Some of the other issues around this truly need more research. So one thing as nurses we all need to do is to stay current, which isn't as easy as it sounds, but it is something that we are responsible for. Long story short, having the spirit of inquiry is vital. That's something that I really learned from our fellow program. We have to ask the question why. Why are we doing a certain thing? Why are we putting people on their head in hopes of raising their blood pressure when it really doesn't work? Evidence-based practice is not about working in a research lab. We can each take steps one at a time to improve and increase evidence-based practice in our own environment. So our first step is ask the question. Second step is stay current. Read. Third step, get involved in some way, shape, or form. I know we all have a lot of different priorities, but we can volunteer to collect data or disseminate information, put together a poster, whatever you can do. So in closing, I would like to say that I am grateful for the friends that I made in the fellowship and all of the knowledge that I learned, and most of all, the spirit of inquiry that was ignited within me. So I challenge all of you to go to work and ask that why question. Why are we doing it this way? And see if there's information out there. Remember this quote from Thomas Paine. A long habit of not thinking a thing wrong gives it a superficial appearance of being right. Thanks for listening, and I encourage all those who are even maybe considering applying to the fellowship program, please know that it is very worthwhile. And stay involved, especially with SGNA. Thank you.